Melatonin can be a game changer for improving sleep, recovery, and performance if you use it correctly. The ideal dose is 3 to 4 milligrams. Take it 3 hours before bed. Hey there, I'm Dr. Mark, and over the past 5 years, I've had the privilege of working very closely with almost 400 people each year, from NCAA swimmers and hockey players to professional hockey players to high school football players to grandparents to entrepreneurs to everyone. And the whole game is helping them recover from concussions, optimize their performance, and getting them back to doing what they love. On this channel, we focus on concussion recovery, athletic performance, and nutritional strategies to help you recover faster, perform better, and get back to living your best life. Today, we're going to dive into a popular sleep supplement called melatonin. So we're going to talk about the science behind it, how we can use it to help you sleep better, recover faster, and perform at your peak. And the key thing that we're going to talk about in this video is knowing the right way to time your melatonin and the right way to dose your melatonin for optimal sleep and performance. So the key things, science behind melatonin and how to use it to help you sleep, the best dose and timing, that's going to be the key thing in this video. And then how melatonin can help you improve your performance by optimizing your sleep quality. So the science behind it, melatonin, if you did not know, is actually a hormone. We all know it sort of helps regulate sleep and wake cycle. We take it to help us fall asleep. So it's naturally produced in your body, but sometimes supplementation is needed when your natural rhythm is disrupted. So think about traveling, jet lag, night shifts, or athletes with weird game and travel schedules. Melatonin naturally starts to increase as the day ends. As light starts to dip, melatonin starts to rise, and it helps your body recognize that it's time to rest, it's time to sleep, by signaling to your brain, hey, levels are increasing, it's time to sleep. So what melatonin does is it actually helps promote your sleep onset, so how fast you fall asleep, and then helps regulate your circadian rhythm. So as light goes up, melatonin should drop. As light goes down, melatonin should rise. And you have sort of this natural sleep wake cycle. Sleep wake cycle. As melatonin dips, you wake up. As melatonin rises, you fall asleep. That's normal. That's what we want. Things like overhead lights in our screens and caffeine can mess that up. But generally speaking, in a textbook, as melatonin goes up, it helps you fall asleep and it helps regulate your circadian rhythm. Let's talk about how melatonin affects your sleep, your performance, and your recovery. And most of that is going to be through how it impacts your sleep, which is really intuitive. Melatonin helps with your sleep onset latency, which is just a fancy way of saying melatonin is effective for reducing how fast you fall asleep. The time it takes you to fall asleep is shorter. The study evidence shows that around 3 to 4 milligrams is the most effective dose for improving sleep onset and total sleep time. However, timing it when you take that 3 to 4 milligrams is just as critical, and we're going to get to that. We also know that sleep quality, so there's a difference in sleep quantity and quality. We want you to get that 8 hours of sleep, but we will also want that 8 hours of sleep to have appropriate staging, not too many interruptions. We want you to get your deep and your REM. We want those sleep cycles to occur. And so melatonin actually promotes deeper sleep, especially in the first few hours of sleep. That's when we get our deep sleep for our concussion patients. That's when we get our glymphatic clearance and clearing of the amyloid and inflammatory markers. And this is critical for our cognitive functioning, even our immune health, and our muscle recovery. So the optimal timing for melatonin is actually 3 hours before bedtime. So there was a recent meta-analysis, systematic review, where they found that 2.5 to 3.5 hours, or about 3 hours before bedtime, is the best time to take melatonin because it aligns best with your circadian rhythm. So you take that dose 3 hours before bed, and in the 3 hours that your body's absorbing it and rising blood levels, that's matching sort of that circadian rhythm to fall asleep. Let's talk about recovery. So sleep is essential for muscle recovery. When we get those deep stages of sleep, it helps facilitate muscle regeneration, reduce inflammation, and even balance your hormone levels, because at night during these deep stages of sleep, you should actually pulse out growth hormone, which is going to aid in recovery. And then when we think about performance, this one should also be intuitive, but a good night of sleep helps with mental clarity and performance. So quality sleep, aided by melatonin, can enhance mental sharpness, reaction time, and cognitive function, which is all key for athletic performance, but even entrepreneurial performance and parent performance. So a well-rested athlete, a well-rested parent, a well-rested anyone is going to perform better in terms of focus, decision-making, and overall performance. So that's the field, the court, the gym, the playground, the living room, anywhere. So let's recap on how to use melatonin correctly. Let's talk about the dosage and the timing. Research from a recent meta-analysis I referenced earlier, but again, to recap it, suggests that 3 to 4 milligrams taken 3 hours before bed is optimal, #ideal, whatever, for improving sleep onset and sleep quality. Doses above 4 milligrams do not really show improvements in there's a diminished return to sleep quality You might actually feel more groggy the next day. We're not going to cover it in this video, but as you get to higher doses, melatonin is actually a very powerful antioxidant, particularly for the brain. So as you get to higher doses, there might be benefit there, but we're not going to go down that rabbit hole. So importantly, start with 1 to 3 milligrams if you're new to melatonin. So start with 1 milligram, see how you feel, increase to 2 milligrams, see how you feel, get to 3 milligrams, see how you feel. Try to get to that 3 to 4 milligram dosing, but don't exceed 4 milligrams. So once we get into like 5 milligrams or more, that's when we definitely start to feel more groggy. But again, we might want to push through that. There's different nutritional strategies that we can leverage to not get groggy and reap the antioxidant benefits. And just to reiterate when to take it, because when you read the bottles and when you look online, WebMD and all these places, you'll see take melatonin 30 to 60 minutes before bed. When we want to take it, according to the latest research, is about 3 hours before your desired bedtime. If you're going to fall asleep at 10 p.m., take it at 7 p.m. Like I take my melatonin with dinner most nights because I want to fall asleep around 10 p.m. This allows your circadian rhythm to align properly. It improves your sleep onset, and it improves your sleep quality. For athletes with late practices, training times, taking melatonin 2 to 3 hours before bed is ideal to reset your sleep-wake cycle. So if you keep melatonin in your gym bag and as you hop off the ice or as you leave the court or whatever, popping that melatonin before you go home or before you hit the bus can actually help sort of reset that rhythm. The last thing is just to not overdo it. So melatonin is generally safe. It's not addictive. It's well tolerated, but it is important to strategically use it rather than relying on it every single night. So overuse, particularly at higher doses, may interfere with your natural sleep-wake cycle, but more research is needed to confirm that effect. It probably doesn't, but we don't want to mess with that if we don't have to. So consider using melatonin strategically during temporary sleep disruptions. So things like jet lag, late night training, irregular scheduling. Again, as a parent, as an athlete, a shift worker, you might need to use melatonin. But the big thing is you want to prioritize a consistent sleep hygiene and lifestyle that sort of optimizes your sleep and sleep quality. And then aim to use the lowest effective dose, 3 to 4 milligrams. Try to avoid more than 5 milligrams each night unless you're using it for a specific purpose, not the topic of this video. So in summary, melatonin can be a game changer for improving sleep, recovery, and performance if you use it correctly. The ideal dose is 3 to 4 milligrams. Take it 3 hours before bed. I keep emphasizing that point because that was the key thing here. I've been telling patients to take it around 2 hours before bed. The new research says around 3 hours before bed. That's now what I'm echoing to everyone. Proper use of melatonin can help you sleep better, recover faster, perform at your best. So have you ever tried melatonin for your recovery? What's your experience? Let me know in the comments. And if you want more tips on improving your performance, recovery, and health, make sure to check out the other videos on my channel. Thank you for watching. Don't forget to like, subscribe, and do all the YouTube things. Until next time, I'm Dr. Mark.